My name is Tracy Penrod, and I'm an assistant professor for the medical assisting and phlebotomy program, and also the acting program director for those two programs as well. I did my strong workforce project on Meta 110, which is medical terminology. The reason I chose this course was because it was it's the most widely distributed prerequisite within our allied health program. It is a prerequisite for the medical assisting program, for the health information management and health information technology, as well as the RadTech program. And so all four of those programs have to go through this prerequisite. Our other three allied health courses or allied health programs, the VetTech, the dental assisting, and PTA also have lots of students that take this course, although it is not a mandatory prerequisite. It is just a recommended course. So because of that excessive innovation with all of our programs in allied health, I made a decision to use this course to look at, to use this course as a base for this program or this project. So some things that looking at the analysis, I guess I should start off by saying that I had taught this course 4 semesters on campus, never online, although we have been teaching this course online for a number of years and have had extremely good success with the online version of this course. And so as I'm going through numbers and looking at things, I think it's important to note that although we have a lot of the numbers that were based, I've been one of the primary ones teaching this on campus, to where we have a number of other instructors teaching it online. It is one of those courses that does seem to have a much better success rate online versus on campus. And so I suppose when I look at this data, I'm looking at only on campus numbers, and so I guess we're looking at ways to try and increase the outcomes and success of those students taking this course on campus, because there is as I've taught this course and talked to them about why they opted to take it on campus versus online, a lot of them say that they really want that face-to-face interaction. They really thrive in the classroom setting and feel as though they need to be held accountable, and that they won't be as accountable if they're left to doing it in an online format. There does seem to be not as much as the online students, but there does still seem to be a good amount of core students that really want that face-to-face interaction. So as I go through the data, that's something that I'm looking at, that I'm looking primarily at this course as from an on-campus standpoint. I have since then, since going through and teaching 4 semesters on campus, I've now actually taught some online. And I have found, just with the 4 classes that I taught 2 classes online in the spring of 2020 and then 2 over the summer, that yes, indeed, they do seem to do better online. My success rate, I was getting 2/3 of the students getting A's in both of my spring and spring and summer classes. So as opposed to maybe about 1/3 getting A's, and I'm only using A's because it's off the top of my head, but it does seem to be that there is a much better success rate now that I've taught 4 online courses with this online format. So as I go through here, I guess I'll be focusing more on ways that we can increase the success rate for students on campus. So as I looked through the data, some things, the 2 big things that kind of stood out were the overall enrollment of African Americans isn't very high. The total percentage was about 11%. Of that 11%, there was a 73% retention rate, but only a 36% passing rate. So that was something that stuck out numbers-wise, because there was such a large, even though we're only looking at 11% of the total student population in this class, there was a very big disparity between the retention rate and the passing rate. There was a little bit, not quite as stark of a difference with Hispanic students. We have a much higher enrollment, almost 40% is Hispanic in demographic, and their percent retention rate was 77 with a passing rate of 53. So that's still not a very good percentage, but I guess the one that stuck out the most was the African Americans that had 73% retention rate, but only a 36% passing. So that was the one parameter that I kind of focused on and wanted to try to start to narrow that gap a little bit by maybe 10 or 15 points, start trying to figure out ways to increase the passing rate and get that number closer to the retention rate. Okay. So as I formulated things, I was looking at ways to try and find a way to narrow that gap. So the things that I was looking at, I looked at 4 different aspects of things that I wanted to try and put into the action plan. 2 of them were things that I could do a little bit more in a little bit more of a sooner or short-term goal, and then a couple of them were something that will probably be more of a long-term goal. So the first 2 that I was looking at was, as an instructor, I had always been I always do an introduction paragraph and always try to find out about the students. I usually ask them why they're in the course, what brought them to that course, and give me just some information about themselves and what their future goal is in medicine. Most of the time when they're taking medical terminology, it's because they're planning on going into some area of medicine. So I try to get an idea, a feel for what that goal is, and then try to work with that as we go through. And so now it's kind of hard because now we're in COVID, and so we're not on campus. So now I'm kind of doing this online. So this thing that I've now thought about introducing to us as well as the online students, but trying to just get a little bit more information from them. So what I'm going to plan on doing next semester, now that we're online again, is to do a discussion post, an initial student discussion post, getting some information about themselves like we just talked about. But then I'm going to do sort of a part 2 follow-up with an assignment that won't be viewed by everybody else. It just asks more personal questions. I did not realize that it was appropriate or okay to ask, students' age, their ethnicity, whether or not they were a foster child, vet, some of those high-risk categories. I'd never really thought that it was okay to delve that deep into their information. And so I focused more on what their goals were as far as getting out of the class and what their future goals were, but didn't actually go and delve into some of this other information. So the first kind of action plan goal was just to create an assignment that would give me some more information about their background, get more demographics, and just get some more information as far as what they have going on and their challenges within their life. So that was one thing that I was going to employ both online and on campus, but obviously we're not on campus right now. So that was first thing, was going to be to include more information. I'm still going to do a discussion post about the other things, but this would be more of an assignment that they're just turning into me, so that that information's not available to everybody. So online I would probably do a part 1 and a part 2. Same kind of thing. Once we get on campus, I'll do some sort of introduction post where they're introducing themselves to each other, and then figure out a way or just do an assignment to get more personal information about them. So I'm a little bit more aware of where we're dealing, as far as their high risk factors or their challenges that they may be encountering as they're going through this course. So I'm going to try to make myself more in tune to that and more aware of that. So that's kind of part 1. The other thing, part 2, was going to be doing after some discussion with other instructors, finding out some of them do an 8-week or somewhere in the middle of the course, they do like a how's things going, like we're checking in, we're halfway through, what seems to be working for you, what's not. So I was going to employ that as well, both on campus and online, and just kind of get some feedback as far as how everybody thinks the course is going, how they're feeling, and if anything could be changed that would make it better for them. So that was the second part that I was going to employ. I'll probably do that online this semester and try to make sure I do both of those things online next semester. The other 2 things that I looked at doing are probably more future goals, since we are online right now and next semester and things are still a little bit up in the air. I had a conversation with Sean Fawcett about instituting part of of work-based learning, and possibly looking at some of these students and maybe trying to have part of their grade be based on an interview with someone in the professional field that they want to go into, or their career that they're aiming for at that point. And so we talked about maybe instituting that as an assignment. Logistically, it could be difficult to do that. We prototypically offer 22 of these courses throughout the year. We usually do 8 in the fall, 8 in the spring, and then usually 6. A lot of those are online. And so it could be logistically difficult if there's 50 students per class to try to set up 400 interviews in the fall, 400 interviews in the spring, and probably 300 in the summer. We're looking at probably 1,100 students more or less that go through per year. And so I had some contact with her regarding doing something like that. I just don't know logistically whether or not that would be something that would be possible or plausible with the amount of students that we have, especially the summer session. So whether or not it might be something that we do a trial basis on, where 1 or 2 classes try it and see how it goes and get some feedback. That might have to be something that we look at maybe when we get back into campus and are actually able to do that kind of stuff. Right now we're going into the workforce, going to hospitals and clinics is very limited. They're not taking volunteers and students. So I really don't think this is something we're going to be able to even think about looking at until probably the fall of 21 or the spring of 22, until when COVID calms down and allows people to actually be, in a visitation into a clinic setting or a hospital setting. But it is something that I've thought about, maybe on a limited basis, trying 1 or 2 classes and seeing how it goes and then what the response is. And so the other issue would be, if this did work, being able to get all of our adjuncts that teach this course on board. That is one thing that I would have to look at with any of this action plan, or the latter 2 that I'm talking about, getting all of the adjuncts on board, or whether or not this information, this curriculum development is only for a couple of the courses, or whether it's something we want to develop with the adjuncts across the board. So I'm still kind of looking at that and formulating that and thinking about that aspect of things. And then the last thing that I had kind of contemplated with the on-campus version was possibly looking at turning it into a hybrid. It would be nice to have posted lectures and testing done online, and then to be able to spend maybe an hour and a half on campus once a week, where we could actually go through and focus in on answering questions, going through the test if need be, and then to maybe take some of that class time rather than having to lecture and take tests, where we could actually do case studies, group and individual disease presentations, and be able to kind of break down some of these chapters and really dig in. So they're getting stuff at home online where they can listen to the lectures that are pre-recorded, be able to do the testing there, so that when we actually come on campus, we could actually start to break these things apart and really start to focus in on the diseases and focus in on case studies, because most of these programs that they're going into, case studies and being able to decipher x-ray forms and knowing all of those, being able to get into reading a SOAP note and understanding what's being done and what needs to be executed, what needs to be followed up from there is important. And so I'd like to go through and start teaching them how to do these case studies. And I've done it in the past, but because we have to spend time lecturing and spend time taking tests, it can sometimes take away timing wise. So if we could have an hour and a half where we could focus on these things, I think it might make the course a little bit more effective. They could have their at-home time, take the tests when it works for them. We could still set it up modularly, where they listen to the recording, take a quiz, maybe a quick quiz before they come in. They'd have a couple of days to study for the test, but in between there, we could be doing some other things that would help make this, help kind of bring the midterm to life, because it can be kind of dry because it is a terms-based course, but we want to integrate the disease processes and the the labs that are being drawn, and a lot of the testing and testing modalities that come into it, because all of that plays a part as they go through. So those were the 4 things that I was looking at. The first 2 I'm probably going to institute online starting next semester. The other 2 things I'm going to have to kind of look at maybe doing it in a limited capacity once we get back on campus, which will hopefully be, we're going to hope for the fall of 2021, since we're not going to be there in the spring. So these are things that I'm looking at, and once again I have to kind of make decisions on whether or not we only offer it limited to 1 or 2 classes, or whether or not we're going to open it up and have to involve all of the adjuncts. So the latter 2 are things that we'll probably shoot to do within a year or 2, or at least think about trying, or at least looking at capacity wise to see if it's something that can be logistically done. But once again, we're going to have to get back on campus before that happens. So that kind of summarizes what I was looking at, the 4 points. And thank you very much for listening, and I guess I'll go ahead and close for now. Thanks.